Across cultures, across classrooms, across conversations, one misunderstanding keeps returning, a quiet confusion that shapes how people talk about anatomy, health, and identity. A confusion so common it slips into language without anyone noticing. Two words, used as if they were interchangeable, as if they described the same structure, the same place, the same part of the body. The vulva and the vagina. Separate systems, separate functions, yet constantly merged into one. But the moment you look closer, the entire picture shifts. Because most of the time, when someone says vagina, they are actually describing the vulva, the external anatomy, the visible structures, the clitoris, the labia, the opening itself. While the vagina is internal, a muscular canal hidden from sight, a passage with roles completely different from the surface. However, the deeper truth is this. The confusion isn't just a linguistic slip. It's a product of history, culture, discomfort, and silence, an inherited misunderstanding that has followed generations. And that misunderstanding matters. It shapes how symptoms are described, how pleasure is understood, how education is delivered, how people relate to their own bodies. Imagine calling the lips, the cheeks, the mouth, and the face all by one name. Imagine referring to the entire face as the throat. Imagine how every conversation about expression, sensation, or health would warp. That is what has happened here. To understand why these two structures became fused in language, we need to trace the anatomy itself, the way medical texts were written, the taboos that erased terms from everyday speech, and the cultural shortcuts that replaced precision with convenience. A mix-up repeated so often that many people never learn the difference until adulthood. To make sense of it, we must go beneath habit and into the actual architecture of the body. Let's go inside. To understand why the vulva and the vagina became interchangeable in everyday language, we have to begin with what they actually are. Not as two similar words, but as two biologically distinct regions, each with its own structure, its own sensory landscape, its own purpose. The vulva is the external architecture, the part visible from the outside, the surface anatomy that interacts directly with the environment. It includes the mons pubis, the labia majora, the labia minora, the clitoral hood, the clitoris, the urethral opening, and the vaginal opening itself. A collection of structures with different tissues, different sensitivities, and different functions. The vagina, in contrast, is internal, a muscular canal, flexible and expandable, lined with rugae, home to a delicate microbiome that maintains acidity and protects from infection, a pathway for menstruation, for sexual penetration, for childbirth, a space designed for internal support rather than external interaction. These two regions are connected, but they are not the same, and yet, language repeatedly collapses them into one. Why? Part of the answer lies in visibility. The vagina cannot be seen from the outside, so for many people, the external anatomy feels like the beginning of the vagina, a shortcut that becomes a habit that becomes culture. When a structure is hidden, the mind tends to treat everything around it as one continuous area, and the lack of clear language reinforces that mental blur. But the confusion goes deeper. For centuries, medical texts were written from an external viewpoint, often by men describing female anatomy without lived experience. Diagrams were simplified, details of the vulva were minimized, and complex structures were condensed into simplified explanations. The word vagina became the clinical term used most frequently, the default label that made its way into education, healthcare, and media. The vulva, meanwhile, carried layers of cultural discomfort. Many societies viewed open discussion of external female anatomy as improper, creating a vocabulary gap where the more acceptable term replaced the accurate one. Education reinforced this gap. Classrooms focused on reproductive organs, the uterus, the fallopian tubes, the ovaries, while the vulva was often skipped entirely, reduced to a small label on a diagram, or omitted. Students grew up recognizing the internal system, but not the structures they could actually see, touch, or feel, creating a generation that technically knows the reproductive cycle, but not the anatomy of the body's surface. To understand why this matters, we need to look at the biology more closely. The vulva is a sensory-rich landscape, especially through the clitoris, which contains thousands of nerve endings concentrated for pleasure. The labia provide protective coverage, changing in shape and texture across puberty, hormonal cycles, and life stages. The vulvar skin responds to friction, temperature, irritation, and hormonal shifts. It is an externally responsive system, designed to interact with the outside world. The vagina is an entirely different kind of space, internally dynamic, self-lubricating, microbiologically active, capable of stretching dramatically during childbirth. Its pH is acidic, maintained by beneficial bacteria. Its tissues respond to hormonal changes more deeply than external skin does. Its sensations and functions are not the same as those of the vulva. When these two structures are conflated, important distinctions are lost. For example, irritation of the labia becomes described as a vaginal problem. Clitoral pain becomes mislabeled as vaginal discomfort. Vulvar skin conditions get mistaken for infections of the internal canal, and subtle symptoms become harder to communicate accurately to healthcare providers. What begins as a language issue becomes a medical one. Beyond health, there is the psychological dimension. When people do not have precise language for their own anatomy, confidence decreases, conversations become vague, and the sense of ownership over one's body weakens. When the vulva is not named, it becomes invisible in discourse, and anything invisible becomes easier to misunderstand, dismiss, or overlook. Cultural silence around external anatomy reinforces shame. But when a word becomes normal, when vulva becomes as neutral as elbow or shoulder, it changes the emotional landscape. Language is not just descriptive, it is regulatory, shaping how comfortable someone feels discussing pain, pleasure, hygiene, or anatomy. The confusion also affects interpersonal communication. When partners use the same word to mean different things, clarity is lost, expectations shift, and experiences become harder to express. Accurate naming fosters clearer relationships, clearer discussions, clearer understanding of boundaries, sensation, and comfort. Yet the most profound part of this story is not the anatomy itself, but the realization that naming something correctly is an act of reclamation, a way of returning specificity to a region that culture has generalized for too long. Because when the vulva and vagina are understood as separate, the body becomes clearer, more organized, more meaningful. Anatomy becomes knowledge, knowledge becomes agency, and agency becomes confidence. And this clarity marks the turning point. When we finally separate the vulva from the vagina, something deeper becomes visible, something far beyond terminology. The realization that language does not just describe the body, it shapes the way we understand it. A single word can blur an entire landscape, and a single correction can illuminate it again. For many people, learning the difference feels like a small revelation, a shift from a vague mental picture to a clear, grounded understanding, the kind that brings comfort rather than confusion. Clarity invites confidence, and confidence invites connection. to the body, to communication, to health. Recognizing the vulva as its own region restores visibility to structures that have been overlooked for generations. Structures responsible for sensation, protection, expression, and external function. Understanding the vagina as an internal canal restores its specificity, its dynamic biology, its role in reproduction, microbiome balance, and internal support. These two systems work together, but they are not interchangeable, and naming them accurately honors their complexity. This distinction also reshapes how people talk to doctors, how they describe discomfort, how they explain what they feel, where they feel it, and how long it has been happening. Precision becomes a bridge between experience and diagnosis, between confusion and clarity. Silence becomes less necessary when the words themselves feel safe, neutral, and understood. Culturally, breaking the habit of misnaming is an act of undoing old patterns, the kind carried by textbooks, media, and unspoken rules about what is appropriate to mention. Replacing that habit with accuracy is a quiet form of empowerment, a way of reclaiming ownership over one's own anatomy. And at the personal level, something even more intimate happens. People begin to see their bodies not as abstract shapes, but as organized systems with intention, design, and history. A map that was once smudged becomes readable again. In the end, the importance of distinguishing vulva from vagina is not about correction for its own sake. It is about giving people the vocabulary to understand themselves, the confidence to speak clearly, and the permission to approach their own anatomy with respect instead of hesitation. Because when we name things correctly, we honor them. And when we honor the body, we deepen the relationship we have with it. A small shift in language, a profound shift in understanding.